Do you know why Indian doctors earn 10 to 20 times less than doctors in the US, UK or Australia? I've heard people say if Indian doctors start charging like US doctors, no one will be able to afford healthcare. And you know what? They're partially right. Because our healthcare system is not built for balance, it's built for survival. Indian doctors are among the most hardworking professionals in the world, yet we are among the least rewarded. We treat hundreds of patients every week, often working 12 to 14 hours a day, and still, at the end of the month, our income doesn't even compare to what a mid-level nurse earns in a Western country. The reason is complex. It's not just about salaries, it's about the structure, mindset, and the economics of healthcare itself. To understand how we got here, let's rewind to where every medical dream begins. When a young student decides to study medicine abroad, in Russia, Georgia, the Philippines, Ukraine, or China, it starts with one simple dream. I just want to become a doctor. Their families sacrifice saving, take loans, some even sell property, all to support this dream. But after 6 grueling years of study, they return to India only to face a harsh reality. They cannot practice without clearing the FMGE, the Foreign Medical Graduate Examination. And this is where 80% of dreams starts fading. Every year, thousands of graduates appear for FMGE and only about 10 to 20% pass. The others, they are not failures, they are victim of system that doesn't support transition, that treats foreign medical education as inferior even when it's globally recognized. Think about it. You study anatomy, pathology, pharmacology just like anyone else. But when you return, you're asked to prove your worth all over again. But the problem isn't just the exam, it's the approach most FMGs take towards it. Most FMGs panic, they jump into marathon classes, watch every coaching video, collect every note possible. They spend months trying to memorize everything but end up remembering nothing because FMG doesn't reward volume, it rewards clarity. This exam doesn't test whether you have read Robin or Harrison, it tests if you can apply the basic concept under pressure. I've seen students study 10 hours a day and still fail, not because they were lazy but because they were directionless. You don't need more information, you need structured preparation. Start with high-yield subjects, medicine, surgery, PSM, pathology and pharma. Focus on MCQs, they teach you logic, not just facts. Practice daily revision. 1 hour of revision is better than 4 hours of new content. Simulate real exam conditions. Time yourself, practice in silence, build mental stamina. But even after you clear FMG, the story doesn't end because now begins the real test, your career in the Indian healthcare system. Let me tell you the uncomfortable truth. Doctors in India are not paid according to their skills, they are paid according to the system's affordability. We live in a country where people will happily spend 50,000 on a smartphone but argue over a 500 consultation fee, where a mechanic can charge 2,000 for fixing your car but a doctor is expected to save lives for less. Every single day, doctors save lives under extreme pressure. No infrastructure, no support staff, no insurance coverage, yet they are blamed for every failure in the system. Why? Because in India, the doctor-patient relationship has become transactional. People see us as service providers, not professionals. And this undervaluation is the reason Indian doctors earn 10 to 20 times less than their Western counterparts. But income is just one aspect. The emotional toll is even heavier. Let's talk about the mental battle every FMG faces. The hardest part of being an FMG isn't the exam, it's a judgment. The constant question, you studied abroad, was your degree valid? Are you sure you'll pass the FMG exam? Wahi sare अंडे wale questions. And when you fail once, the society labels you as unsuccessful. But listen very carefully, you don't fail when you fall, you fail when you stop getting up. I've seen students who failed twice, 3 times and still went to become respected doctors. They believed in consistency, not luck. The FMG is not a test of intelligence, it's a test of endurance. Remember this, मन के जीते जीत है, मन के हारे हार.
मन के जीते जीत है, मन के हारे हार.
Once you win your mind, no exam can defeat you. Dear FMGs, you're not failures, you're fighters. You left your country, your family and your comfort zone to chase a dream that only a few dare to follow. You've been through culture shocks, language barriers and sometimes even war-torn countries. Yet you didn't give up. Don't let one exam define your worth. The world needs doctors who are adaptable, global and compassionate. You're exactly that. And one day, when you stand in your white coat, treating patients anywhere in the world, you realize all those sleepless nights were worth it.